are you sleeping? Are you sleeping? I'm Dr. Shelby Harris, Director of Sleep Health at Sleepopolis, and this is Sleep Talking with Dr. Shelby, the show that dives deep into all things sleep so you can get the rest you deserve. Today, we're talking with Dr. Hina Talib to learn how sleep changes as kids and teenagers grow up. But first, did you make your bed today? If so, consider competing in a bed-making competition. You might take home the gold. From Tokyo to Tulsa, bed-making contests have been popping up more and more, with competitors judged in timed challenges across categories like corner tucks, pillow placement, and overall perfection. Past champions are often housekeepers, and many tournaments are associated with the hotel industry, but not all of them. But if you're the kind of person who'd rather just pull up the sheets and call it a day, you do you. So as long as your bed is clean and comfortable, it'll set the stage for a better night's sleep. What's your take on this, Hina? Would you ever enter a bed-making contest?
Oof, I don't know if I would enter a bed-making contest, but I would create a contest where I would ask my children to make their own beds, and then I get to be the judge that awards the prize for the best making bed, and that would actually really help our household out a lot.
That sounds amazing. I've got to figure out some way to trick my almost 15-year-old into that. Yeah, it's pretty bad. I get too stressed over like just putting and I've talked about this online before, the duvet cover, over the duvet. People will send me videos. God. I can't figure it out.
It's not a one-person job. Like it takes multiple people.
Someone sent me a video where someone had to get into the cover.
Right.
I'm like, no.
Yeah, that doesn't even seem safe.
Too much pressure for me. Thanks. So if you like Sleep Talking with Dr. Shelby, take a second to follow or subscribe on YouTube, Spotify, or Apple Podcasts. It seems simple, but it helps us reach a lot more people to get them the rest they deserve. How does sleep change as we grow up? As we become adults, how do our bodies and needs evolve? And if we become parents, how can we help our children get the best sleep possible at every age? To learn more about sleep for kids, teens, and young adults, we've invited Dr. Hina Talib, a dual board-certified pediatrician and adolescent medicine specialist at the Atria Health Institute in New York. Dr. Hina cares for very young kids all the way through to young adulthood. A writer, creative, and mother, she is also the co-founder and chief clinical officer of Thread Health, a digital health service for teens and their families. And on a personal note, I have known Hina for a very, very long time. She's been a good friend since our early days together at Brown University in the 1990s. I have known her since pretty much she was a freshman, and I'm 1 year older in college. So Dr. Hina, I'm really glad you're here and you could be with us today. So welcome to Sleep Talking with Dr. Shelby.
Oh, I'm so happy to be here. And
it's
funny because we are talking about teenagers and young adults today. And that is when you first met me.
I know. Yeah. Little 19 and 18-year-olds, and you knew my husband way back then, who's literally behind me in the different room. All right. So let's talk about this whole like adolescence area. So as we age, our sleep patterns do evolve. And there are some common challenges that people do experience. So, Dr. Hina, what would you say you notice change as kids transition into maybe adolescence and then even to like that young adulthood range? So what sort of sleep changes do you see amongst that lifespan?
Right. So so much changes in the lives socially, emotionally, and in the bodies of a young adolescent. And so young adolescents, we think of them as our middle schoolers, our 11 to 13-year-olds. And some people say early adolescents, young adolescents. And these children, they typically need about 9 to 11 hours of sleep per night. And so their like natural kind of bedtimes are somewhere between 9 and 10, which is a little bit later probably than your elementary school age children. So it'll start to feel like a bit of a shift. And then as you get into your teenage years, so these are our 14 to 17-year-olds, they are typically in high school or high school aged adolescents. And then you have even a little bit more creep, like there is a shift to be even a little bit later for your bedtime. And maybe like around 10:30 to 11:30, you'll start to see the kind of peak time when they might feeling sleepy and ready to go to sleep. And then the total needs for hours of sleep might adjust to about 8 to 10 hours. So just a wee bit less than the early adolescent, the middle schoolers. And then the young adults that you spoke of. Now, these are our kids who are out of the home, college, potentially out of the home for work or for school, for college. They're 18 to 25-year-olds, and they can settle into a pattern that's more adult-like, that is somewhere in the 7 to 9 hours of sleep, but it's more flexible because life is unpredictable, and work schedules and social schedules are even more unpredictable at this age, travel, all of these things. And so there's even more of a struggle, I would say, to balance all of life and sleep as you are in that young adult phase.
Okay, so just so I can synthesize that. So when you have younger kids, they go to bed early, wake up early, to the bane of many parents, the mornings in existence. So then it shifts, like you said, that early adolescence. So what would be like an average age where you might start to see that shift, like around 11?
Yeah, we typically say around 11, but honestly, I've seen it sometimes like you have this 9 or 10-year-old that is sort of like, they're already on the precipice of puberty, or they're
Yeah.
already sort of making those changes, especially if they have older siblings already. Sometimes they just get pulled along for the ride a little bit, and so their sleep times. But yes, around 11 years old, you might start to see that your child goes from a bedtime of somewhere between 7, 8, 8:30 to closer to 9 to 10.
Okay. And then they shift a little later, even more into adolescence. And then once they start to get into that 18, 25, in my work, I see it closer to like the 23 to 25, they start shifting earlier, right? So what would be the main biological or any neurologic or any other reasons that you might see? You had talked about like an older sibling, but what are some of the reasons why this natural shift is happening?
Right. So this natural shift is biological. It is, people often think it's behavioral, but it is actually truly part of their biology. It is normal.
Mm-hmm.
And I think that's an important thing, but also a hard thing, because it's always hard to see your children sort of change before your eyes.
Yeah.
But this is one of those shifts that happen that is very much rooted in biology and neuroscience and neurobiology, and it can be affected by hormones. And so there are a couple of hormones. We often refer to puberty as this perfect storm where there are changes in hormones. We expect and want them to happen, but of course, different parts of your day-to-day can change as a result of it. So melatonin secretion is a big one. So melatonin, as we know, is a hormone that is sort of the hormone of sleep, and it shifts on it secretes it presents itself on a bit of a schedule. But when you go from childhood to teenage years, it shifts about 2 to 3 hours, and it's what kind of helps draw sleep or inspire sleep. Mm-hmm. And so when that hormone shift happens, then your teenager is not sleepy, like is just not feeling that sleep. We sometimes talk about a sleep gate, which is like this ideal time that a person is able to fall asleep easily and has enough kind of push to sleep. And so that gate, that perfect window moves, and it's because of the biology of the melatonin being secreted later as well as a child enters puberty. So that's I would say one of the biggest hormones. But puberty is all about hormones, and so there's also these sex hormones that start flowing. You have estrogen, you have testosterone. Estrogen can affect your temperature and how you sleep, and testosterone can affect how kind of alert and aroused you are. And so you also have progesterone as part of the menstrual cycle. And so half of the month you have progesterone sort of out there, which can make you sleepy, but can also have other things that kind of happen, like make you wake up a few times at the night, make it harder to have deeper sleep. And so all of these things can affect sleep at different times of the month, but also do pull that sleep shift to be later.
Yeah, I think that what you're talking about with the hormones is a big piece. That melatonin aside, because people talk about melatonin left and right, but with girls and boys, I don't know if you've seen this in your work, but we know in research that before they hit puberty, the rates of sleep problems are pretty equal, especially with like insomnia between girls and boys. And then once adolescent hits, that's when we actually see more insomnia in young women. Do you notice that in your practice, especially around the period, anything like that, any of those hormonal fluctuations impacting it?
Yeah, I think this is one of those. I'm so glad you asked this question. I think this is one of those under recognized and under talked about topics when
Yeah.
it comes to the care of young women, young girls. And because we're just now really starting to, I think, be better about talking about periods and period pain and period flow and just sort of helping people understand what's normal and what might require some more attention. But I don't think we as yet do enough of a job of talking about what happens to your quality of life as you
Hmm.
kind of go in and out of a menstrual cycle. And a big part of that is sleep. And so I think we think of lots of different things when it comes to sleep and the interplay of a teenager's life. But something that's biological that I don't think gets its due enough is, well, how are these periods affecting this young woman's or young girl's sleep?
Okay.
And is there, is there ways to, or is there a need to optimize that, or to even just let her know that, hey, you had a couple bad nights sleep and you were maybe a little bit affected with your mood the next couple days because your period had you in pain, or your period was in
Yeah.
this part, the later part of the cycle, and that made you wake up a few times. And it's not necessarily all quote unquote in your head or all mood, but there is a biology behind why you're feeling this way.
Yeah, and I think insomnia, the trouble falling asleep, staying asleep, the quality of
Hmm.
sleep can be impacted. But on the flip side, we also see excessive sleepiness issues that could be around a period. So it doesn't have to just be disrupted sleep; it can be an excessive need for sleep during that time. Are there any ways to track if you have a parent of an
Hmm.
adolescent girl who's interested in this and wants to see if there's a pattern? Like, how would you suggest they start looking into it?
Yeah, I think that's you don't tracking is really helpful because it
Yeah.
gives you what I like to say is I like to have you, the young person, be the detective, be the
Hmm.
person who's sort of looking to put the story together for yourself because you know your body best.
Yeah.
And so I do encourage when we're trying to tease out what might be the most helpful intervention
Mm-hmm.
or goal for us to work on, because there's too many things in a teenager's life sometimes for us to, oh, well, not sometimes, I will say, as a pediatrician, I am, we get 15 to 20 minutes sometimes with a young person, and there is a list of about 55 things I'm supposed to do in that 15 to 20 minutes. And
Okay.
then often, actually it's really helpful sometimes when a parent will come and tug at your sleeve right before the visit, or when you step out and maybe have private time with
Yeah.
the young person and say, don't forget to talk to them about, and it could be social media, phone use, it could be sleep, it could be hormones, it could be this, it could be that. So it is good to have that bit of heads up. But in terms of tracking, then
Mm-hmm.
I think there's a lot of things that it would be helpful once you've identified it as the goal. So if this is going to be the goal that we've identified together, the young person and I, that let's make this a priority for our health. There's a good reason to. Sometimes I really like old-fashioned pencil and paper trackers.
Same.
It depends on also the younger kids sometimes do like that. Your 11 to 13-year-olds, if you can help them with a cute tracker that you can print out online, or you can just make, sometimes they even like making their own trackers, honestly, with moons and stars or whatever the codes are going to be for
Yeah.
how how it went. But sometimes the act of tracking and jotting it down, even for a week or a couple of days, can sort of be illuminating. Oh yeah, actually I do go to bed at this time, or I do go to bed at this time, but I don't fall asleep, I don't think, for a while.
Yeah.
Or this is when I wake up, or this is how tired I was, or this is a challenging morning to get out of the house, because sometimes there's lots of big feelings and family conversations about getting out of the house in the morning when you have a very sleepy teenager, which is,
That makes
again,
sense.
normal. So yeah,
Yeah.
pencil and paper would be my where I would start with many people. But then, of course, as you work with high school age kiddos or young adults, there are a plethora now of digital tools that you can use. It can be as simple as using the Notepad app in an
Mm-hmm.
iPhone, or other sort of kind of like a free-form text place that you can share notes back and forth between family members, or it can be a digital app that's actually designed to track sleep.
Mm-hmm.
And then, of course, there's the wearables that are
Yeah.
also quite popular these days. I'm sure you've heard a lot about these too.
We've talked about them.
Yeah, we've talked about them. Where I have teens who will screenshot me their data,
Mm-hmm.
and it's really great because it opens up a conversation that I can
Yeah.
have about their goal and put it into context for them. Sometimes I
Yeah.
worry about them having all this data without having somebody to run it by and to help them kind of see through it. So sometimes I think the wearables can be too much.
And I would argue not even just for the adolescents, for adults too. Sometimes it can be too much if someone's not explaining it. Yeah. Now, are you finding more teenagers are coming to you to talk about their sleep?
Yeah,
Really?
it's very interesting. And I think the wearables that have been out in the market, because they have sleep information, like one of the
Yeah.
things I'm grateful for, really truly, is that they help to inspire conversations, because the kids look at data. Some kids like data, they like
Mm-hmm.
objective graphs and things, and they respond better to that as
Yeah.
a thread to trace, as opposed to their parent nagging them about it.
Okay.
But both things are obviously important and helpful towards goal making. But yeah, I think that I attributed a little bit to wearables, a little bit to just sleep talk. I think people are generally more attuned and interested in how'd you sleep last night? Like I didn't used to hear that question a lot,
Mm-hmm.
but now I feel like people do, people will ask, hey, how'd you sleep last night? And it's such a nice question, because it's we are trying also to ask people how they feel a lot more
Yep.
now, but I think how'd you sleep last night is so interesting, because it shows that you really care and that you might have noticed something. And now I'm talking to parents, right? So like
Yeah.
a parent asking a teen, how did you sleep last night, feels really sweet, and interested in how their night went, which might impact how their day goes.
Yeah.
And so yeah, I think we just talk about it more culturally too.
Yeah. It's interesting. I do think that they're more keyed and like tuned into it in a different way than I think I ever was. He was like, I'll sleep when I can. Stay up all
Right.
night. Go to get some donuts early in the morning in college. Who knows? We didn't think about that stuff.
Right.
So it's
Right. And
interesting.
there's these like wellness pillars that we talk about, right? And movement and nutrition are up there, big
Yep.
ones. People talk about them all. I think from the dawn of the century, people have
Yep.
talked about them. But I think sleep is really getting in there. So I'm
Oh,
happy
I
about
and
that.
I even argue that it's not a pillar, it's the bedrock because
Ah,
if I say
bedrock.
that
Haha.
all the time because if you're not coming from a solid foundation with sleep, it's
Mhm.
so much harder to build all that other stuff on top of it. So what about talking about mental health, right? What role does mental health play in sleep disruption that you see with adolescents specifically, especially as they move from that childhood to adolescence and into that young adulthood with depression, anxiety, and especially since the pandemic, we've got rates going through the roof.
Yeah, I mean, it is so true. I
Yeah.
think we recognize anxiety, depression, and learning differences like ADHD so much more in young people than we ever
Yeah.
did before. I also think there's just more of it, and the pandemic certainly played a big role with that. But sleep and mental health are so intricately connected,
Hmm.
and I do believe that we are, again, paying more attention to it, and we are able to use, sometimes you think, oh, like, is it because of what comes first, sort of? Like, is it because of the anxiety and the depression that you have
Yeah.
sleep dysfunction, or is it the sleep dysfunction that came first and that makes you more likely to have symptoms of anxiety or depression?
Okay.
And whatever the direction is, what we know is that the first steps sometimes of treating or trying to make the symptom, treating anxiety or depression, the disorders, or just making the symptoms of anxiety or depression better, can be to start with the sleep. And we know
Yeah.
that it's very impactful and it can be very, very effective,
Yeah.
as first steps or part of the treatment plan. So, but yes, I will say with anxiety, as you know, you treat a lot of anxiety in young people and older people, all peoples. But in anxiety in adolescence, we see it a lot in girls,
Yeah.
especially after puberty, and before that, we see it equally in boys and girls. But you can have a harder time falling asleep. You can start to see the
Yeah.
insomnia. It can be racing thoughts. It can be not just not being able to turn off at night. You can have physiologic symptoms too at night as you're trying to fall asleep. Like you feel the anxiety in parts of your body,
Yeah.
like headache, neck ache, heart racing, things like that. And then that leads to a poor night of sleep. And then, of course, when you're tired, you can feel more anxious too, because
Yeah.
that's just how you're not able to sort of think through your thoughts. And then with depression, often in young people, it's a little bit different. Sometimes you have them sleeping a lot more, or they can be having insomnia as well. But it's not as much of the racing thoughts, but they have these they still struggle because
Yeah.
if they're sleeping too much or sleeping in, or it really affects the function of how they are able
Yeah.
to flow through their day. And that's when
Yeah.
it becomes part of the treatment plan to sort of look
And
into that.
and I would say I often work, I mean, it's all different ages, but I work a lot with adolescents who are referred to me from primary or from their pediatricians,
Mm-hmm.
from psychiatry, who's just like, I don't want to start any meds at this point. But the teen is resistant. I mean, this with adults too, but the teen's resistant to going to therapy to work on the anxiety and depression. So
Yeah.
coming to me to work on specific behavioral strategies surrounding sleep to give them that bit of like a little bump to help their sleep a little bit better can then get the ball rolling a little bit better to improve the depression, anxiety, and maybe give them more motivation to work on the other stuff too. So
Yeah,
sometimes yeah.
that's so important, Shelby, because that if you can help even a little bit with the anxiety and depression, and
Yeah.
sometimes that's through talk therapy, like a few sessions with your pediatrician.
Yep.
Sometimes that's the parent actually spending more time and doing activities with them, like movement.
Yeah.
And if you can if you can make a tiny improvement even in their sleep, they may start to feel better enough that then they will be open to therapy, and they will be open to taking on more of the work needed to do to
Mm-hmm.
get them to a better place overall. So that's when I was talking about those first steps. I think sleep
Yeah.
is just because it is so effective. And so when they start to see, oh, I do feel totally different, I feel more resilient, or I feel stronger
Mm-hmm.
against my feelings of anxiety or depression because I had a good night's sleep,
Yeah.
or because I cut back on, caffeine, or whatever our plan is going to be, then it helps to inspire them to continue on that path to
Totally.
making things better.
So, what advice would you give to young adults or parents of teenagers, such as myself, who struggle with the establishing healthy sleep routines or just healthy routines in general because they might have busy schedules, pressures of school and work, even social pressures of things like sometimes, I don't know, I'm just potentially happening in my house. Sometimes the teenager, I know what's right. I know what's going to, sometimes you can feel like you can get into that battle at times. So how would you recommend helping to establish those healthy behaviors without getting into the battle of you must do this to help them see that they should do these things?
Yeah, so much about parenting in these adolescent ages is about partnership. So
Yeah.
you are moving away from this time of really being the CEO of their lives, and sort of making every major decision that
Mm-hmm.
impacts them. And it's so hard to do. And first of all, or how did your kids already become teenagers? I don't know how time flies.
I have an
That's
almost
amazing.
15-year-old. I can't
That's
believe it.
amazing.
I
That's
know.
just amazing. One of my favorite ages is 15, so that's awesome. Um,
it,
but yes, I
yeah.
think that you want to be able to work with their body and with their
Okay.
natural circadian rhythm, and so having that understanding of this is normal.
Yeah.
This is not all because they're trying to give it to me or make my day or morning really, really difficult. This is normal for them and their body. Yet we still have to get to school on time. We still have to have time for homework. We still have to be able to unwind together at night and go to
Yes.
sleep at a certain time. But where can we give a little bit? Where can we make it a partnership? How can we help put them in the driver's seat to be the ones to set that goal and then
Yeah.
make it a smart goal so that they actually help outline the steps and agree to them? So that because if with anything, with parenting or with any health goal you're trying to work on, if they're not invested in it, then it's not something that
Yeah.
any amount of nagging is going to help them on. But I think biggest advice would be pull them in on the goal making. If see that they help them understand that it's important, so that's through education and through
Mm-hmm.
pointing it out, and then pull them in on the goal making, and then start small. Sometimes with all sorts of goals, we just had the New Year's passed, and we're all sometimes it's really hard when we put goals on ourselves that are too big or too hard,
Yeah.
and we expect perfection, or we expect more of ourselves than what is possible. So making picking whether you're going to work on the mornings or whether you're going to work on the evenings
Mm-hmm.
and the wind down time, but picking one part of the day, and then yeah, you have to commit to it, and in partnership with your kid,
Yeah.
to be able to give each other the flexibility and the hope and the cheerleading to be able to get something to become a habit, hopefully,
Yeah.
and then then once it becomes a habit, the grooves are there and it gets easier and you can change your sleep habits. But it does take time and effort. And so being on the same team is really helpful.
A lot of the teens I work with, I find that you get some buy-in when you talk about what are their values, what are the things that they enjoy doing, what are the things that they want to spend their time doing. And for example, like if you have someone who's a student athlete, right? How is sleep? How is that going to help your position in soccer or whatever it is you're doing, so that maybe you will recover better from the workouts? Maybe it will help you with your coordination. Maybe you're injured. It will help you with injury, recovery from the injury. So I do find that also helps a little bit, as opposed to this is what they say you should be getting every single night and all that sort of stuff.
That's such an important point.
Yeah.
Values are so, for all of these health goals, or for tackling mental health issues even, or even just sort of the independent skills that young people need to have in their teenagers, which can feel very hard for parents. For all of these things, family values or just values that a young person decides are their values are so important. And so what you meant, and motivation is the other part of that. So what actually motivates them? Because it's the so what. Like, I don't care about, my brain being organized. Like, I don't care about that.
Yeah.
But what do they care about? You're absolutely right. Our student athletes care about performance. They care about recovery from injuries, for sure. And then you have, we know that sleep is so important for memory retention and for learning. And so if it is a young person who has a lot of exams or a lot of academic work ahead of them, if you tie it to that, then yes, it can help be a motivator for sure.
Even something like musicians, right? So as a musician myself, like you practice during the day, you actually solidify as a basis, the finger patterns that you're using. You solidify that while you're sleeping at night. So find that.
It's almost magical how powerful that is. Yeah, how amazing sleep is to and the other thing that has been helpful for me with some of my younger adolescents, my 11 to 13-year-olds whose bodies are changing and changing at different times, and they all want to grow.
Oh, yeah.
Well, growth. We now know that growth is like, to sleep at night and to work in concert with your growth hormone being secreted at night and to allow it to do its thing and to help your body grow. We know that kids grow more over the summer because they sleep better over the summer. And so if you have a really motivated young grower, that could be another tool.
I was thinking about this earlier today when I knew I was going to be talking with you, is that like you have this amazing kind of subspecialty in adolescent medicine, is that, if that's what you would call it. What would, first of all, I'm guessing there aren't that many of you out there, correct? Yeah.
Correct. So, there's probably a couple hundred of us practicing in the country right now.
Similar to behavioral sleep medicine, like what I do. So what would make someone want to seek out, if they have a general pediatrician wherever they live, what would make someone want to seek out an adolescent medicine specialist if they need to go that route?
Yeah, so some adolescent medicine specialists practice primary care. So just as if you were going to see your pediatrician, you may, at your practice, if they happen to have an adolescent medicine specialist, you may say, hey, I'd love to have that person be my child's primary care doctor. And so other adolescent medicine doctors practice more subspecialty-based care. And that would mean that you come to us because you have a condition or a suspicion of a condition that we have extra expertise in, or your child is, has a complex medical health condition, has a mental health condition, has eating disorder or substance use, reproductive health, sports medicine, nutrition optimization, weight management.
Amazing.
These are all sorts of areas that we uptrain in. So as part of our second board specialty or certification that we have, for me, it's just such a joy to do this work because all of these topics for me are the best parts of pediatrics, or the best parts of the parts that give me the most joy to take care of. And so the idea is that we're a one-stop shop for teenagers because they're busy. They're the busiest people I know in terms of how much they can be overscheduled these days. It's a real shame sometimes. But anyway, that does mean that it is kind of hard for them to get to a dermatologist and a gynecologist and a sports medicine doctor. So the benefit of an adolescent medicine specialist is we can sit there and talk to you very deeply about your sleep and about your mental health, as well as your regular kind of growth and development, and any sports injuries that come up, because we've been trained in those areas a little bit more deeply.
Yeah. And we didn't really talk about today the school start time issue, right?
Oh my
And
gosh.
I know.
But
And if
we
people want a deep dive on it, one of my earliest episodes was with Lisa Lewis, who wrote The Sleep Deprived Teen, which is a fantastic book all about school start time. So we can put that in the show notes also. But yeah, I mean, that must be something that you are constantly battling against in
Yeah,
adolescent
when
medicine.
I was saying before about working with your child's body and not against it,
Yeah.
on a systems level, this is the highest expression of that. We've
Yep.
created a system that works against our child's biology or our young person's biology,
Mm-hmm.
and so I know it's hard and I know it's a complicated topic, but I do believe very strongly that if we could for most teens, it would be very helpful to be able to have that delayed school
Yeah.
start time, so that they can work with their biology.
Yeah, talk about love for Brown University, our alma mater. Mary
Yes.
Carskadden, Dr. Carskadden is the one who literally figured out that delay in the sleep timing for adolescents. So there's a huge history there.
Yes.
But what about misconceptions about sleep in this age that you hear a lot that you just might want to correct? Maybe something you just hear in the media or even from patients or parents.
Yeah, I think this idea that teenagers can be lazy,
Mm-hmm.
or this just sort
Yeah.
of like it's a caricature, but people make jokes about it all the time. As somebody who's on social media, I so many of the parenting accounts, and I know they're doing this in humor, but it is if you are a young person or a teenager watching some of this, it's
Mm-hmm.
actually really sad sometimes, because it's a caricature of a teenager being uncaring, not compassionate, lazy, and just unable to like function and pick up their things, and they forget where
Yeah.
they put their things, and so anyway, I think that that's just scientifically incorrect, and I think that teenagers we need to have a deeper understanding of what they're going through and
Yeah.
what their biology is going through, and I think that sleep is like an excellent example of that. And so when they're really groggy in the morning and they're really really tired, it's not that they're lazy; they're probably just sleep deprived, and their hormones are not at the they don't have arousal in them, like they're not
Yeah.
physiologically awake at that hour,
Yeah.
and so it's a struggle. So that would be my number one thing. I think that I think we have well-meaning first steps sometimes that we talk about, like this idea of you can catch up on sleep on the weekends,
Mm-hmm.
and then also about limiting phone time or screen time before you
Yeah.
go to sleep. And I think that advice is it's more complicated than that. And sometimes we you don't want to run with advice that doesn't feel right for the child in front of you,
Yeah.
because the child in front of you may be anxious and may be using that 30 minutes of watching Gilmore Girls because they
Thank
heard it
you.
was something interesting back in the day, but it makes them really happy, and then they
Yeah.
fall asleep fine right after
Yep.
it.
Yep.
That's not a kid that I'm going to be barking up.
No.
That's not a kid I'm going to be barking up a storm to say, take that Gilmore Girls away, because it
No.
works for them.
Yeah.
And so I do think that there's advice out there, and I think it means well and it's really
Yeah.
good, but I don't think you should necessarily for every child be taking their phone away at night an hour before they sleep. But for many children, it is actually good advice. So
Yeah.
just know the child in front of you and know their schedules. The same thing about catch up on the weekends. Some people will say, oh, it's absolutely fine. And other people will tell you, do not let them sleep in on a weekend. It'll mess up the whole rest of the week. But
Mm-hmm.
you need to know your child.
Yeah.
For a lot of the adolescents that I work with,
It's
a
fine.
Saturday morning sleep in for a couple of hours is actually really helpful.
That's what I do.
Yeah.
Saturday morning sleep in and then kind of a middle path on that Sunday. So it's
Yeah.
not such a
a
harsh
big
reality.
shift on Monday
Exactly.
morning. Absolutely. So,
Yeah.
but take all of this advice that you hear from us on media with the understanding that
Yep.
the child in front of you may have their own
Exactly.
needs.
Absolutes are never the right way to go with a lot of this stuff. So, as I say it in an absolute form, it's never the right way to go. All right.
Yeah.
So, we always like to end with a segment, something to sleep on. So, it's one last point for anyone who's looking to change their sleep habits or to help their teens' sleep habits. So, considering everything we talked about today, do you have one final thought for our audience, maybe something to sleep on?
Yeah, I would think of sleep as a vital sign, something so very important to your
Vital
health.
sign.
Just as important as the menstrual cycle or blood pressure, sleep is a very helpful and useful vital sign. It could be a early call to attention that something might not be right or might be challenging for your young person. So we talked about mental health earlier. It might be your first sign that your young person is struggling with something when if they go from one sleep pattern to a completely different one.
100%.
And so I think just pay attention, recognize that it's an important biological phenomenon, and that it's very, very powerful. It can help us. It can help us make things better, make symptoms better if we work with it.
I love that sleep is a vital sign. I have never thought about it that way. Thank you. So thank you so much for being here, Hina. I could talk about this all day with you, and I have talked about
I know you could. I know you just could.
I can talk sleep all day long. So thank you. This was really a lot of fun, and I know a lot of people are going to learn a lot from it. So thank you.
Thank you for having me. It's always a pleasure to speak with you and to speak about these important topics for young people.
Thanks for listening to Sleep Talking with Dr. Shelby, a Sleepopolis original podcast produced by Ready Freddy Media. Remember, if you're tired of hitting snooze, hit subscribe or follow right now in YouTube, Apple Podcasts, Spotify, or wherever you're listening. And for even more sleep tips, visit sleepopolis.com and my Instagram page at SleepDocShelby. Until next time, sleep well.